Let's quickly discuss the important points of HRT. What are the common indications for HRT? The most common indication is hot flushes. Others can be senile vaginitis, GUS, that is genital urinary syndrome, which includes urinary urgency, osteoporosis, and Alzheimer's disease. Urethral syndrome also is a part of GUS. What are the routes by which HRT is given? Oral, transdermal, or local vaginal. Oral, we all know that it can be a combination of estrogen progesterone for patients who have an intact uterus. Patients who have been hysterectomized, they don't have a uterus, they can be given simply estrogen. When is subdermal patches or transdermal estrogen patches given? When we need to bypass the first pass metabolism. That is when the patient is a case of metabolic syndrome, she is obese, she has high triglycerides, she has impaired hepatic function, or there is an increased risk of thromboembolism. What is the advantage of giving vaginal estrogen? First of all, it is very good cure for senile vaginitis and urethral syndrome. It does not lead to any changes in the osteoporosis or vasomotor symptoms. Progesterone need not be given because the systemic absorption of estrogen is very low. Local estrogen will decrease the vaginal pH, make it acidic, and will let the lactobacilli grow. Apart from local estrogen creams, there are rings available which contain estrogen. The content of estrogen that they release every day is 8 mg in 24 hours, and they have to be retained inside for 90 days. Controversial points about HRT. Although it is reducing the risk of osteoporosis, but it is not given to prevent osteoporosis. Although the estrogen content in the HRT is good for the heart, it is protective for the heart, but it is not used to prevent CHDs. It has a beneficial effect by decreasing the colorectal cancer, but it has no effect on cervical cancer. HRT should never be given to women who are less than 60 years of age. Moreover, HRT should never be given once the menopause has been more than 10 years. So if the patient has passed 10 years of menopause without any problems, without any medicine, they should not be given any HRT. Risks of HRT. 3 types of cancers are increased because of HRT: CA breast, CA endometrium, and ovarian cancer. Risk of congestive heart disease is increased if the HRT is used for a longer number of years. So in that case, transdermal route is better. Risk of venous thromboembolism is increased with HRT. It can also lead to gallstones and liver dysfunction. Absolute contraindications of HRT are 4. One is stroke, then venous thromboembolism, undiagnosed genital bleeding, and estrogen-dependent neoplasms. What are the relative contraindications for HRT? Congestive heart disease, cholecystitis, active liver disease, prior history of jaundice due to cholestasis, prior history of endometriosis, and known or suspected or history of breast cancer. These are relative contraindications for HRT. Thank you.